Hey everybody, Dr. Mike Kwast here with iChiro Integrated Medical Clinics. Today I just wanted to give you a little explanation on the difference between a massage gun and some of these instruments that we use in the office. They're very different, but sometimes patients and just the public, they get confused, they think they're the same. So let me give you the rundown. Massage gun. These are great instruments. They work on vibration. So when you're using these and you're working a muscle or wherever the tight spot is on you that you're working, it's using vibration to work those muscles, which is a great tool. It's gonna help bring blood flow into the area, it's gonna stretch it, it's gonna reduce pain. How does it reduce pain? Vibration in the nervous system takes priority. So when you put this on something that hurts and it vibrates, your brain will just hear the vibration and it will actually suppress the pain signals so that you don't feel pain. So it's a great way to naturally reduce pain. It's kind of like if you've ever hit your thumb with a hammer and then you shake your hand and it feels better. It's because the vibration, the shaking actually reduces the pain signals coming in. So it's a great tool for that. One of the instruments we have in the office, this tool, this does not use vibration. This is actually using a strike. So when we put this tool on, it's actually hitting the muscles. And when it hits the muscle, it's actually gonna cause a stretch reflex in that muscle that makes that muscle reflexly relax and let go. So it's a reflex. It's kind of like if you go to the doctor and have an exam and they do like a reflex where they use a hammer and they hit your knee and your knee kicks. That's a deep tendon reflex. If we put vibration on your knee, it would not reflex, or they wouldn't use a hammer, they would use a vibration tool. So the striking causes a reflex. Now the reflex that this causes is not a deep tendon reflex, it's called a muscle stretch reflex. So it's a different reflex, but I'm trying to just get you to understand the concept and the idea of how this actually works. So when we're putting this on the muscle, it's striking, the muscle then reflexly relaxes, even if it's been restricted for years and years and years. When it does that, it then sends signals, those receptors send signals to your brain, which then tell your brain what's happening in that tissue. Oftentimes, muscles, when they're injured, get taken out of play by your brain. Your brain will stop using them because they've caused an injury. So your brain doesn't want those muscles to activate. This, by resetting that, we can rehabilitate that neuropathway, causing a better functional result in the person's movement patterns. So very different tool from this. Both are super beneficial in their own ways. What would be best? You do both together. That's how you get the best results, is we combine the different therapies, try to get the best results for each person. Because when your function improves, you never lose. Hope this helps to understand some of this stuff. Dr. Mike with iChiro Clinics. Have a great day.